Today I want to talk about biomaterials in plastic surgery, especially that of the face. In facial plastic surgery, outcomes don't only depend on surgical technique or an artist's vision, but they also rely on what lies underneath the skin. And the structural foundation of any facial implant has to be safe, strong, stable, and biologically inert and harmonious. So there's a lot of things that we need to check off here, and that foundation underlies the implant material itself. Today, titanium and polyether ether ketone, better known as PEEK, represent two of the most significant innovations in implant-based facial surgery. The use of any alloplastic, meaning foreign material, in reconstructive surgery dates back over 100 years. And early materials like ivory and waxes like paraffin and gold plates were used as far back as World War I to restore facial defects, often with unpredictable results. But in the 1950s and 1960s, advances in chemistry and metallurgy introduced materials like silicone and methyl methacrylate, or PMMA. These really allowed for better form and function, but carried their own issues like high rates of infection, exposure, encapsulation, and displacement. But by the end of the 20th century, there are two distinct needs that emerged. Number one, the ability to restore structure following trauma, cancer, or congenital malformations. And number two, aesthetic enhancement driven by elective procedures to harmonize or augment facial features. Meeting these needs required materials with far more specificity and sophistication. And that led to the surgical adoption of titanium and more recently PEEK, which I talk about quite often on this channel. Let's start with titanium. So titanium itself is a transitional metal, and it's known for its high strength to weight ratio. So we see it in bicycles and sporting equipment and even military. It's got excellent resistance to corrosion and biocompatibility. And its first medical application was actually in the 1950s, when in 1952, Dr. Per Ingvar Brånemark accidentally discovered that titanium bonded to bone during a rabbit experiment. This phenomenon was later termed osseointegration, and that revolutionized both orthopedic surgery and dental implantology. So titanium, super cool, became the preferred material for load-bearing skeletal implants. And in craniofacial surgery, it got really popular in the 80s and 90s for orbital floor reconstruction or blowout fractures of the eyeball, mandibular fixation, and later even custom bone replacement. The core material properties of titanium are as follows. It's 4.5 grams per cubic centimeter, which is lighter than steel, but its stiffness of 110 GPAs is closer to cortical bone than steel. It's also very resistant to corrosion by forming a stable oxide layer called titanium oxide in vivo. It also osseointegrates, so it fuses directly with bone, promoting long-term stability. And today, titanium is available in plate form, meshes, and even 3D printed custom implants with either porous or solid interiors. And these can be fabricated using something called selective laser melting, SLM, or electron beam melting, EBM, allowing very intricate internal structures whilst maintaining load-bearing capacity. But what you'll hear me talking about more and using more is PEEK, polyether ether ketone. And that's how polymer engineering is now meeting aesthetic precision. PEEK was really synthesized in the 1970s by Imperial Chemical Industries and quickly found applications in both the aerospace and automotive industries because it's exceptionally resistant to chemical erosion and mechanically stable at high temperatures. In medicine, it entered spinal surgery as soon as the 1990s, replacing metal rods and cages in vertical stabilization procedures. And the advantage of PEEK was very clear. It's radiolucent. So when you get a CT scan or an MRI scan, it's not going to interfere with the imaging. And that's a lot different than other metals. And this allowed post-operative evaluation of surrounding tissues without the metallic artifact or display or the bright white lights that we'll see with other metals. And in the early 2000s, PEEK made its way into cranial implants, initially as an alternative to titanium mesh in cranioplasties and eventually into facial aesthetics and reconstruction. So the core material properties of PEEK are as follows. The density is 1.3 grams per cubic centimeter, which is significantly lighter than titanium. Meanwhile, its modulus of elasticity or stiffness is about 3.6 GPa or gigapascals, which is closer to natural bone. Its radiolucency is a great feature because it doesn't interfere with medical imaging, and it's got a very biocompatible and inert surface that makes it non-reactive and chemically stable when it's implanted. So unlike titanium, PEEK doesn't integrate with bone. That's one of the issues, but I could see it as a positive thing. Instead, it's secured with screws or fixation plates, and its thermoplastic properties make it very easy to machine and even allow for us to print it. It has exceptionally smooth contours, and it is ideal for cosmetic implants. Now I want to talk about the pros and cons of these materials. So let's review. The titanium pros include strength, durability for structural, skeletal reconstruction, a history and track record of proven osseointegration where it integrates into bone. It's got a much longer clinical track record for facial applications than PEEK, and it's customizable like PEEK by digital manufacturing. It's resistant to mechanical stress. It looks super cool. But the cons of titanium is it does give you these sort of splay artifacts on CT scans and MRI imaging. It could be palpable, it could be visible if it's placed too close to the skin. Some patients report cold sensitivity, and it's challenging to remove once it's osseo-integrated. And it also, like PEEK, requires soft tissue coverage or it can become exposed. The most important con of titanium is the possibility that you could be allergic to it. The pros of PEEK, however, are that it's radiolucent. It's excellent for post-operative imaging. It doesn't interfere. It's super lightweight and minimizes load on the soft tissue. It's also, like titanium, customizable with precision milling or additive manufacturing, aka custom 3D printing. It's really, really good for cosmetic cases, and it's minimally palpable, and it doesn't have that foreign body feel that metal, for example, might have. But the cons of PEEKs are that it's so inert that you don't really get any natural osseo integration. There is also a risk of infection because it's so inert that you can get biofilm surrounding it. Finally, it requires rigid fixation to avoid either migration or malposition of the implant, and it's also more expensive typically than titanium. There are some reports even that it extrudes in poorly designed or poorly secured implants. So how do we reduce these risks and complications for both materials? For titanium, for example, you can get implant exposure in patients with either thin or irradiated tissue. If it's improperly placed, it could impinge on vital structures like the infraorbital nerve and affect sensation of your upper lip and teeth. People also report type 4 hypersensitivity, which is a rare but possible allergic reaction. You can imagine how unpleasant that would be. The implant needs to come out. Ultimately, it comes down to patient-centered decision-making though. Material choice isn't really a technical decision. It's more about clinical strategy based on your own anatomy, your expectations, your goals, your health, and your long-term vision for how you want to look. Some patients require skeletal reconstruction after trauma. Others want cheek or chin enhancement, really with no visible scars. And finally, others may still need a combination of both. And each patient demands a careful assessment of these risks, fixation methods, and how the material will perform over the years, not just weeks. And this is what all factors into our decision making. At my practice, we emphasize full facial imaging, 3D modeling, a very close digital collaboration with engineers and peers, and thorough patient education about implant behavior and risks. We also engage in long-term planning that includes the possibility of removal or replacing it. And you've got to be educated on these possibilities. My final thoughts are that in the world of facial plastic surgery, no two faces are the same, and neither are the materials that we use to shape them. Titanium and PEEK are more than just options. They're tools, they're solutions, they're opportunities, each with its own history, benefits, and risks. By understanding how these materials work, where they came from, and what they offer, we can give patients more than just a good result. We can give our patients longevity, comfort, precision, and safety. The material really matters, and so does the surgeon who truly, deeply, and sometimes obsessively understands it. Well, thank you so much for taking the time to watch this video. If you like this, be sure to subscribe, turn your notifications on, and don't hesitate to ask any questions in the comments section below. Thank you so much.